office, what kind of symptoms were you having?
Yeah, I was having lower back pains. I had a pinch in my lower back where I could not bend over to perform any activities, any normal activities. Like I had a problem brushing my teeth when you bend over for the sink or just tying my shoes. I had a lot of irritation when I would sit for long periods of time, which affected a lot of my work, a lot of my. Well, I mean, you couldn't sit down and have a meal comfortably because you'd have to keep move on one side, move on the next side, and I would frequently have to use the restroom, get up at night, which would make me lose my sleep, which would eventually lead to bad moods, you fatigue, and I couldn't exercise, which was a big routine of my was a big part of my daily weekly routine was getting some exercise at least 3-4 times a week,
Hmm.
and I had a lot of pain in my lower back. My sleeping, laying down, I couldn't lay face forward. I had to be on my back, and that those were pretty much quite the main symptoms that would really stood out to me were those because a lot of my normal activities were affected.
Now, let me ask you this. Being at your age, did you feel like that was normal for you to have all those pains?
No, to be honest, when I first came in, I've always been active since I was young, since I was in high school. Right now I'm 23 years old. I've never had a problem with my back. I've always been lifting weights, squats. So when I came in here with a back pain, I really didn't think it was anything serious. But when I had the X-ray done and we found out that my disc was that I had a pinched nerve and my disc was was slipping down, I was worried because I mean at my age you don't see a young man who's been active his whole life actually come down with something like that. So I was worried, and no, I didn't think it was normal. And when you explained to me what it was and what the program was going to do for me and everything, I was a little skeptic because I've never had this problem. I didn't know what to do, and I was a little worried. I was a little scared, I could say. So no, I didn't think it was normal. But since I started the program, I mean, it took like 3 weeks, I would say, and I could already feel the pain going away, and I could feel that I could sit and I could sleep a little comfortably. It just as time progressed, I can feel the pain just go and go, and up to this point, I really don't feel anything. I come get adjustments because I know I need them, but I mean, I feel great. I can move. I feel a lot freer in my lower back, so
Hmm.
I've seen a lot of improvement.
Okay. Now, do you feel like maintaining it and making sure it just doesn't go back to the way it was and fixing it all the way is important versus just getting rid of the pain only?
Yeah, yeah, because and that's a great example. I mean, I actually went through that where I had the lower pain come to me. I think it was about 2 months before I actually came to see you. I had the pain, and my lower back was really hurting.
Hmm.
So like I mentioned, I never really had lower back pain. So I thought nothing of it, and I let it sit for about 2-3 weeks. I let it sit. The pain went away. I just went back to doing my normal activities. I went to the gym one day and the pain came back. And that's when I got worried. When the pain came back, and to be honest, when the pain had gone away, I thought I was fine. But when the pain came back, that's when I knew I had to see somebody. I had to see a specialist, a chiropractor. And when I came here and I spoke to you about it, I knew that I had to do something about it because I could have the pain go away, but just like it happened to me, the pain's gonna come back a month later or 2 months later, and I won't be able to perform any sports or any workout routines or any of my daily activities because the pain is gonna keep coming back. The pain can go away, but the problem is still there.
Right.
Yeah.
Right. Right.
So
So now a big difference between before and now is you're seeing a huge difference before you started and then versus now in the way your activities are and so on in your work.
right.
How many hours can you work now without any problems?
When I first had the pain, to be honest, the part-time job was what I was working. I was doing 4 hours, and it was it was already enough for me. 4 hours was already enough for me to just get up and be waiting for the clock to be on the dot so I can get out because the pain was really hurting for me to get some ice in there. And at this point, today, I'm working 12 to 13 hours a day without having any issues. Of course, I get up and walk around and I make sure my posture is up to help myself. But to be honest, I can work 13, 14 hours a day, 12, 13, 14 hours a day without having any lower back pain.
Okay. So do you recommend like people that have conditions like yours with the spondylolisthesis, like you're talking about, with the bone slipped forward a little bit, to at least try to see if chiropractic could help them out?
I would definitely recommend to whoever any issue with your back. I've come to realize since being here and seeing all the different symptoms, all the different phase one, and all the different irritation that you can get. I would recommend anybody to see a chiropractor because your back is what controls your whole body.
Mm-hmm.
If you really know the anatomy of the back, like we were talking about it, every nerve comes out to your back from your legs to your abdomen to your upper body. So if you have an issue with your back, you definitely need to see a chiropractor because it's going to affect your whole life. It's going to affect your activities. It's going to affect your work. It's going to affect your relationships because your moods are not in a good mood. Ask anybody who has lower back pain if their mood is good.
Yeah.
So yeah, get your back fixed because your back is what drives your whole body and your back is what you need.
Excellent. So last but not least, is your wife really happy now that we got you fixed?
My wife, my family, they're happy, but more than happy, they're relieved because they were worried. They've never had anyone in my family come with a lower back pain. They've seen me since I was young, and I've never had issues. I've never been hospitalized ever until this lower back pain that I got. So they were worried, but more than happy, they're really relieved that you were able to help me and
Excellent.
that you're helping me.
It's always a pleasure. All right. Thank you very much, sir.
Thank you,
You take care.